All right, so the Mommy Makeover. I love that procedure because it's reconstructing the entire body after you've had those little rugrats, those beautiful children that created a hurricane type category 5 destruction on the body. The breast has come down, the stomach may be overhanging, you might have loose muscles, you got stretch marks. They really did a good number, but they're certainly gorgeous and well worth it. So here's where we come in to try to make things good again. And I can try to rejuvenate the body and in many occasions get you a body that was even better than before you had the children. So the Mommy Makeover typically involves a tummy tuck, liposuction, some sort of breast lift, and possibly fat grafting to the buttock. Every case is different in terms of what needs to be done. So the tummy tuck is usually involved in a Mommy Makeover, but how long will that scar go totally depends on how much overhanging skin you've got. In some people it just goes from hip to hip, and other people it goes farther back, and other people it goes all the way around. Very rarely, almost never, can it be that many tummy tuck. It's usually a lot more extended. I do try to hide the scar in the bikini line if we can. We will tighten your muscles. I'll make you a new belly button. During the procedure, I can inject Exparil, which is a pain medicine that I inject in the muscle, and it can only be injected during surgery, and you get really no pain from the tummy tuck. It's amazing. You'll get discomfort from the liposuction, but the tummy tuck pain is dramatically decreased. Okay, so the first part of the Mommy Makeover was the tummy tuck. How far will your scar go? We don't know until we're in surgery, and it varies on the amount of loose skin that you've got. It does lift up the hoochie wanuchi. It does pull down all the excess skin. It does tighten the stomach muscles. In the Mommy Makeover, remember, it involves breast surgery. Do I just need to do a breast augmentation? Can I use implants, or can I use fat, or can I use a combination of the both? Will vary on the scenario and your interest. But do I need to do a lift? And can I do a lift or a reduction without using an implant? Maybe I can use fat, maybe I can use nothing, or do I need to use an implant? Or do I need a combination of a lift, implant, and fat? The fat is an amazing way to reconstruct it and give it a very natural look. I love fat. So we've talked about the tummy tuck, how long the scar goes, we don't know. We've talked about the breast, whether I can just make it bigger, whether I need to lift it and make it. Now, when I use an implant, this is important. I'm not necessarily making it bigger because I'm removing a lot of that breast tissue of yours that's no good. It's really droopy, it's saggy, so I'm removing some of your breast tissue. I got to replace it with something that's more perky and youthful, and that's where I use the implant. So it doesn't necessarily have to be bigger at all. It can be the same size, or it could even be smaller. So don't worry about that, but every case is different. The next part of the Mommy Makeover is what starts to turn it into the Mamacita Makeover. Well, what's that? That's where I take fat, I liposuction the waist, the back, and I transfer that fat to the buttock. And what I do then is that I'm three-dimensionally contouring your body. Not only have I worked in the front of the stomach, in the boobies, but now I'm reshaping the buttock because as we age, we lose fat from the buttock and it starts to droop. Now, it's not about making it bigger if you don't want. It's about shape. So it's about being shapelier, perkier, and prettier. It doesn't have to be bigger, but it can be prettier. So if you do want it bigger, we can definitely do that. But when I do a Mommy Makeover, I'm limited to the amount of fat that I can remove, and that's usually 1 liter. That typically I can get some of the waist and some of the back, depending on how much fat you've got, but it's 1 liter of pure fat. If I'm doing a Mommy Makeover, I for sure would do the liposuction and the fat grafting to the buttock. A Mommy Makeover takes me about 5 hours. You get to go home that day. Getting back to work is about 10 to 14 days. I will put you in a garment, but not that day. I'm going to wait 3 to 4 days to make sure the circulation is okay. Remember, do not smoke. Smokers have a 25-fold increase in complications of losing skin, losing the nipples, losing the areolas. So definitely stop smoking for sure, and don't resume smoking for at least a month after surgery. So bottom line is, I do the tummy tuck, I do the Mommy Makeover procedure, we leave drains in, we put you in a garment 3 days later, you're back to work in 2 weeks. It's about 6 months to see your final results. Whenever you're doing a breast lift, you got to remember that you do have the risk of losing nipple sensation, breastfeeding ability, and in some cases, even discoloring the areola or even losing the entire nipple areolar complex. If that happens, there's ways of reconstructing it and it can look pretty good. Thank God those things are rare, but they still happen. So bottom line is that a mommy makeover is a wonderful way to gain your youth back, your sexiness, and your sex appeal back. I look forward to hearing from you. Talk to your coordinator so that she can give you pricing, scheduling, when it can be done. She'll answer all those wonderful questions that you need to know and want to have answered, and she'll be very helpful with you. She'll even talk to you about financing if you want. Bottom line is, I can't wait to see you. Stay safe. Looking forward to meeting you.